Hello, I'm David Blumenthal, National Coordinator for Health Information Technology. I'm pleased and excited to say that the registration process is now open for healthcare providers to obtain significant incentive payments for adoption and meaningful use of electronic health records. The incentive payment program is aimed at accelerating the nation's adoption of health information technology. Healthcare providers throughout the nation can qualify for this funding. Under the HITECH Act of 2009, Congress set aside up to $27 billion over 10 years to help support providers' adoption and meaningful use of electronic health records. Doctors and other eligible professionals can qualify for incentive payments totaling as much as $44,000 through Medicare or $64,000 through Medicaid. Hospitals can qualify for incentive payments totaling some $2 million or more. National adoption of health information technology will constitute an historic turning point for healthcare in America. Starting with adoption and meaningful use of electronic health records, health information technology will provide better care for patients, easier care to provide for providers, and long-term healthcare cost and quality improvement for the nation as a whole. High-tech programs, combined with professional leadership, are turning the tide toward a future of HIT-assisted and supported healthcare. After years of sluggish adoption, healthcare providers are planning to take the plunge. 81% of hospitals plan to take advantage of the incentive payment program, and 80% of those plan to act during stage 1. That's in 2011 and 2012. That means that 2/3 of the nation's hospitals are already planning to act in the next 2 years. For their part, 41% of the nation's office-based physicians are also planning to take advantage of the incentive payment program, and 80% of those are planning to act during stage 1. Only 14% of physicians say they will not act to become meaningful users of electronic health records. That means that 1/3 of the nation's office-based physicians are already planning to act in the next 2 years. Why are providers choosing to go now? Availability of incentive payments is one reason. Availability of federally supported technical assistance is another. The guidance provided through the meaningful use process, which provides clarity regarding how to use electronic health records and assurance that certified electronic health records will support those uses. And leadership by the nation's clinical and hospital professional organizations are a very important element. Cooperative leadership and unprecedented new resources are making the difference. We recognize that electronic health record adoption and meaningful use are hard work and big investments, especially for smaller practices of primary care providers. That's why incentive payments and technical assistance have been made available under HITECH. Incentive payments can offset a significant amount of the investment. 62 regional extension centers across the nation are prepared to offer customized, on-the-ground assistance, especially to providers without significant HIT resources or expertise, such as small practice primary care physicians and small hospitals. All providers owe it to themselves and to their patients to learn about this incentive program and the other supports. The number of providers already planning to act is gratifying, but we believe that many more still need to learn about the opportunities they have. Acting during stage 1 means maximum funding through the incentive payment program. Beginning in 2015, providers will see reductions in their Medicare reimbursements for not meeting requirements of meaningful use. We believe it is in providers' interests, patients' interests, and the nation's interests to move during stage 1 to the adoption and meaningful use of electronic health records. We are committed throughout this process to protecting the privacy and security of personal health information. All the information that providers need is at the CMS website at cms.gov/EHR incentive programs. To contact the regional extension center that serves their area, Providers can also find Regional Extension Center contact information at healthit.hhs.gov/REC. Thank you so much for your time and attention, and good luck with becoming a meaningful user of electronic health records.